Tonight, we're really going to start to look at what would it take to create this idea of a rural health community, a rural health care model. What would that look like in Fergus Falls and Ottertail County? We're going to start diving into that a little bit.
It's obvious we need to change health behaviors, but you know, you mentioned education. But you can educate me all you want if I still want to have that drink, and I still want to smoke, and I don't care how much I weigh. How do we shift it?
How accessible is our healthy foods to people that live on their own, that are elderly? Like, you know, you always see the Schwann's truck go around. Why don't we have a healthy fruit and vegetable truck go around?
The demographic graphs will show you that the huge cost, geriatric cost, comes in the last 2 years of life. Huge. And those are all of the same kind of morbidities that increase exponentially as you get to that window. And so healthy lifestyles and all that aside, that's nice, but you're still going to have a huge cost toward the end, and we need to really work on that.
How much of our healthcare dollar is being paid on non-treatment related expenses? And for those of you that are providers, the billing activity and the administrative overhead activity. So one of the things we said was, can we achieve the goal of having 90% of our healthcare dollars going to treatment? Is that possible?
One idea that was kind of neat is, let's say you get a meal at McDonald's or something, instead of fries being the automatic choice, you get fruit and you have to ask to change it to fries.
The first time I talked about the 19 teaspoons of sugar in a 20-ounce soda, I think that's the right proportion, our department got a call from someone who happened to grow sugar beets and was claiming then that it's really the corn growers that are the problem with the sugar beets. But that really raises the question about when we start to tackle things that impact businesses and the livelihood of our communities, we need to engage the farming community in this case, I think, in these conversations. If we're going to advocate against the use of their product, is there another use for it or somebody else that really needs it?
Ensuring the health of our community is going to take all of our agencies working together, and how can we not duplicate efforts but build upon each other and make sure that all of our community members have access and that it becomes a long-term investment for our community working forward.
We need to quit relying on just medications or a procedure to fix us and really begin to look at what can we as individuals do to help ourselves and then also help to lower our healthcare costs.
It was interesting to see some of the statistics for our group. I think a lot of us were aware that we have an aging population. That maybe wasn't all that surprising, but also to see some of the lifestyle and health choice issues as it relates to obesity, activity level, or lack thereof. And you know, many I think would think that when you live in a rural community and maybe more of an agricultural community, we'd be a lot more physically active than what the data seems to suggest. So that was something that was an eye-opener, I thought.
I think creating a rural health model that works is fully within the grasp of this community. And it takes conversations like this for each of us to put ourselves out there, take a little risk, and say, you know, sometimes the things we hear we don't want to hear, and that's okay. Because if we talk to each other and we look at who's here, who's not here, and make sure we include everybody in our conversations, we're going to come to a good solution.